Welcome to the Private Practice Survival Guide podcast with your host, Brandon Seigel. I'm a published author, speaker, entrepreneur, and private practice strategist dedicated to transforming the way that healthcare functions. This podcast is all about empowering you to create the change you want to see. Let's dive in. Thanks for tuning in. In this episode, we're talking about how to avoid HIPAA pitfalls and common mistakes in private practice around HIPAA. Now, I know with HIPAA, we all kind of roll our eyes. We're like, oh my gosh, like we try so hard, and yet it feels like you can't win. And the reality is that our goal with HIPAA is to make sure that we show there's no gross negligence, that we're making every effort possible within a reasonable accommodation to protect the patient health information at all cost. And I would say I've never walked into a practice that I could not say they had potentially a violation of HIPAA, but some of it is not gross negligence, some, et cetera. The thing with gross negligence means that you're not making the effort to try and know what is right and wrong. You need to show that you're getting training and testing and, certifying, and you're taking those extra precautions possible. Um, Even something as simple as like the clipboard with people's signature, how you protect that data is really important, and consistency. So, here are some common issues that I'm seeing in practices, and I see it very much across the board. So the first thing is I am seeing inadequate employee training. Staff are lacking proper training. They're not getting certified. They're not being trained on a regular basis in the HIPAA regulations. And it's leading to unintentional violations like discussing patient information in a public area or mishandling records. And even the element of we should not be discussing patient health confidential information with other staff members unless it is related to the treatment and applicable. So even that idea of like, oh, did you see Brandon today? Man, he's got a wound that is infected and he doesn't even know. That's breaching privacy. Unless that's a nurse that's working on me or something, you should not be having that conversation. And again, we all are interpreting this differently. So you may say, I disagree, Brandon. I can talk to whoever. We're all under the same staff. The idea of staff sharing is about collaboration on treatment, approach, etc. The gossip could be seen as a breach of HIPAA, just so we're all clear. The other common issue I see is unsecured patient health information storage. We're failing to encrypt or securely store protected health information. So it could be as simple as leaving physical files accessed, storing digital data on unprotected devices. So even if the data, let's just give an example, the data is in an EMR, you leave your laptop, and your child knows your laptop's code, gets into your laptop, can go to your browser and log into the EMR with the stored password code, that would be a HIPAA breach. So that would not be properly stored. We see this with home health all the time. It's like you write your chicken scratch notes, you leave it in the car. What if that car gets broken into? That chart gets stolen. I've seen home health therapists and nurses actually have their cars broken into, and yes, health information got stolen. So there's two different things. There's the storage of it, and then there's the transmission of something being protected. Transmission means how we send it, and that vehicle of sending information that has PHI, that it is encrypted. We're also showing weak access controls, allowing unauthorized personnel access to PHI due to poor password practices, shared logins, or a lack of role-based access in our restriction process. The other common issue I'm seeing is improper disposal of PHI. We're discarding patient records without shredding physical documents or securely wiping digital files, risking exposure. What about laptops? What about all of that? How are they properly disposing PHI? I recently had an employee that worked remote that had a certain storage responsibility. When she was leaving our company, she brought that all back because I, as the owner, need to physically shred all of that paperwork. I did not know she was writing notes and things like that. And so we had to work on her HIPAA compliance with that. We are always looking at ways to make sure nothing got exposed. So there's a breach and then there's proper handling. So just because there's not a breach doesn't mean that you're in compliance. So I want to be clear. A breach means that you have to actually, there's follow steps to alert of a breach. There's a world where you protect something and there could still be a breach, but we still need to make sure that we are instilling all of the requirements to stay compliant with storage and facilitation of PHI. The other thing is often I see a lack of BAAs, business associate agreements on file, not signing BAAs with vendors, IT services, billing companies who handle PHI, leaving practices liable for third party breaches. Very, very important. So, talking to how your vendors protect PHI. Do they facilitate a BAA with you, or are you sending them a BAA? Typically, the vendor is sending you a BAA, just so we're on the same page. Um, we're also seeing a common issue of inadequate risk assessments, failing to conduct regular security risk assessments, identifying those vulnerabilities in systems and processes, etc. Having the right risk assessment process and showing a continuity of those test runs is really important. We're seeing a delayed breach notification, not notifying patients when there is a breach, or notifying HHS, Department of Health and Human Services, or other required entities within the 60-day time frame after a breach. So really understanding that is crucial. The most common thing that I'm seeing is unencrypted data transmission. You think because you use Microsoft or Google and they're storing it with a BAA that it is encrypted. Often it's not. You need to send PHI via with encryption. And so I use a software called Paulbox, Paubox, great software, and it lays on top of every email that goes out so that every single email that leaves my entity is fully transmitting in an encrypted basis. And then the storage by in my case, Google, is BAA'd and set up with all of the right HIPAA compliance, etc. These are things we want to work on. And it's a work in progress. No one's perfect. I'm not perfect. I can tell you that. So it's a desire to continue to improve how we protect our PHI. The other thing is outdated policies and procedures, using outdated HIPAA compliance policies, failing to implement written protocols for handling PHI, failure to continue to train and support your staff. Another common issue I see is when a lost or stolen device, when an unencrypted laptop, phone, or USB drive containing PHI is being lost. I do not recommend anything being stored on laptops, phones, or USB devices. But still, it's important that you look at that, and that could lead to potential breaches. So here are some preventative actions to help ensure you don't have a HIPAA breach. I recommend conducting regular staff meetings. I recommend training all employees annually. And there's different ways that you can train HIPAA. There's Mineral, there's other HIPAA certified courses. Utilizing at least annually a HIPAA regulation course, focusing on handling of protected health information, recognizing phishing attempts, and maintaining confidentiality. Include role specific scenarios to reinforce compliance for all. Two, I want you to perform routine risk assessments. I want you to be conducting annual and biannual security risk assessments to identify vulnerabilities in the physical, technical, and administrative safeguards, addressing gaps promptly, such as outdated software, weak access controls, etc. I want you to implement strong access controls. Use role-based access to limit PHI exposure. Enforce unique logins, strong passwords, and multi-factor authentication for systems containing PHI. Encrypt all patient health information. It's so important. Servers, devices, in transit, emails, file transfers, softwares you're using, use secure communication tools like encrypted email, HIPAA compliant messaging apps, etc. And then obviously, like I said, we want to secure our BAAs, make sure we're working with vendors and third parties that know how to handle PHI. Sending a BAA is not enough. They must also know how to handle your data. So that's really important. We want to develop, we want to update our policies. We want to maintain written HIPAA compliance policies, both employees, vendors, as well as our patients. We want to explain the way that we handle breaches, device security, when we're able and when we're not able to discuss health confidential information. Reviewing and updating these policies regularly to reflect regulatory compliance. We want to use secure data. We want to ensure that we know how to dispose of data. And so when we are disposing of data, we want to make sure we are shredding it correctly. We want to secure and wipe all files. We want to make sure that we have a written disposal process in our policies and procedures, that we implement clear procedures for retiring hardware. When you're changing out laptops and hard drives and desktops and things like that, that disposal process should be a written process and policy. We want to deploy robust cybersecurity measures. We want to install firewalls, antivirus software, intrusion detection. We want to regularly patch software systems to protect against vulnerabilities. We want to monitor and audit these systems, continuously monitoring access logs for unauthorized activity, conduct periodic audits of PHI, etc. And then 10, we want to prepare a breach response plan, develop a clear incident response plan outlining steps for identifying, containing, and reporting breaches. So I talked about this briefly, but it's so important that you understand the value of an encryption software. It's critical for HIPAA compliance. It is what's going to protect your PHI from unauthorized access, ensuring confidentiality and integrity. Now, under HIPAA, encryption is considered an addressable safeguard, meaning covered entities and business associates must implement it unless they can demonstrate it's not reasonable or appropriate with an alternative safeguard in place. However, encryption is effectively a de facto standard due to its role in preventing breaches and avoiding penalties. And so here are some key benefits with encryption. We're going to prevent data breaches. We're going to encrypt data so that it renders PHI unreadable to unauthorized users. We're going to reduce the risk of data exposure, and we're going to also be able to protect when devices are lost, stolen, hacked, because everything is encrypted. We're going to use the safe harbor provision under the HIPAA breach notification rule. Encrypted PHI involved in a breach does not require notification if the encryption meets NIST standards, and that it's considered secure. Regulatory compliance. Encryption aligns with HIPAA security rules, requirements for technical safeguards. It is going to help you avoid fines. It's going to protect you, and it's also going to, in my opinion, build patient trust. Secure handling of this sensitive data is really crucial to that patient trust component. When information needs to be encrypted. So, again, I am not your consultant here. You need to do your research. You need to take on your responsibility. But PHI at rest, PHI stored on devices, servers, media, etc. PHI must be encrypted when stored on any device or system that must be accessed by an unauthorized individual. Examples include laptops, tablets, smartphones used by staff to access patient records, external hard drives, USBs, cloud-based storage, etc. Use encryption methods like AES 256 to ensure data remains unreadable without a decryption code. PHI in transit. We need PHI transmitted electronically. It must be encrypted when it is sending via email, text, file transfers, remote access. Now, I want to say text one more time. We don't recognize that text is often not encrypted unless you're utilizing a special product platform app that is specifically encrypting it. No one wins the race alone. From January 28th through the 31st, 2026, the Growth Code Conference in Coral Gables, Florida, connects you with other high-performing private practice owners, leaders, and managers. Share strategies, draft off each other's momentum, and cross the finish line together. Visit growthcodeconference.com to register today. So whenever we send any patient health information, whether that be to a billing company, even if you're sending it to another BAA, that transmission must be encrypted. So even if it's an authorized party, how we send it, that sending should still be encrypted. Using TLS 1.2, 1.3 for emails, That's one of the things we're looking for in the encryption. HTTPS for web-based systems, and ensuring end-to-end encryption for sensitive transmissions. We want to also look at specific scenarios requiring encryption. Mobile devices, any mobile device used to access, store, or transmit PHI must be a device level encryption enabled. Email communications must be encrypted unless the patient explicitly consents to unencrypted communication and it's documented in writing. When we are cloud storing, we want that processed in the cloud with encryption so that we know that that cloud provider is signing a BAA and also goes over their encryption process. Backups, any backups, tapes, external drives containing PHI must be encrypted to prevent unauthorized access. The only exceptions that you may want to look into is encryption is not required if the practice can document that it's not reasonable or necessary for internal systems with robust alternative safeguards like air gap networks, etc. However, again, this is extremely rare. And so, as the encryption has become industry standard, I want you to recognize it is a standard. Unencrypted PHI may be used in secure internal environments within a firewalled EHR system if access is tightly controlled, but it does carry risk. And I'm going to say that again, it does carry risk. So as we continue to look at this, we want to use NIST compliant encryption. We want to ensure our encryption tools meet National Institute of Standards and technology guidelines, such as the AES 256 for data at rest and TLS for data in transit. Very important. Again, a PAL box will tell you how they encrypt, what their encryption process is, etc. We need to implement this across systems. We need to deploy encryption softwares on all devices, email platforms, storage, handling, everything. We need to regularly test it. We need to update it. There are companies that all they do is try to see if they can break your game. So you want to train your staff, you want to make your documentation decisions, you want to encrypt in all costs possible. And so when we're looking at HIPAA, PHI, there's this like discrepancy of what is patient health information or not. I always say proceed with the most caution. I always say protect it, protect it, protect it. But this is an example. You need to check with a consultant, so don't take my word for it. But under HIPAA, PHI is defined as any individually identifiable health information that is created, received, maintained, or transmitted by a covered entity, healthcare providers, health plans, clearinghouses, or their business associates in any form, electronic, paper, or oral. PHI is subject to strict privacy and security protections under the HIPAA privacy and security rules. Specifically, PHI includes, but again, do your research, individually identifiable information, data that can be used to identify an individual either alone or in combination with other information. This includes demographic information, name, address, phone number, email, security, social security number, date of birth, and other identifiers. Unique identifiers, medical record numbers, health plan beneficiary numbers, account numbers, device serial numbers, biometric data, fingerprints, voice prints, or facial images, other identifiers, IP addresses, license numbers, any code that can link to an individual. That is our individually identifiable information. And then health related information. This is information related to an individual's physical or mental health, healthcare provision, payment for healthcare, and that may include but not limited to medical history, diagnoses, treatment plans, test results or medications, what services they're getting healthcare wise, date of services, appointment details, provider notes, billing information, claim data, insurance details, payment records tied to an individual. Something as simple as a receipt, in some cases, could be considered PHI because it's showing a service was delivered with that person's PHI with health information on it. What falls under the PHI protection? Patient records in an EHR, billing forms with patient names and procedures, often receipts that have this information, emails discussing a patient's treatment, text messages to a patient in regard to their treatment, their approach, anything like that. Now, one of the things that I get asked a lot is, well, what if the patient emails me? Well, it's their job then to be responsible. But if they email you unsecured information, that's on them. But when you respond, you must respond with a protected approach. The mistake many make is they're like, hey, they sent me a text, I responded. I go, yes, but your response wasn't encrypted. And they say, well, their response to me wasn't encrypted. I go, that's their problem. That's not our problem. They can choose what they want. It's their information, but we are required, even in response to them, to make sure we're encrypting and protecting that data. And so even things like oral discussions about a patient's condition in a practice fall under patient health information, fall under HIPAA. So if you go sit in the waiting room and you're like, hey, how's that back feeling? Did what we do yesterday work? Have you thought about having surgery? That should not be happening in front of other people. X-rays, lab reports labeled with a patient name or ID. These are all examples of PHI. Formats that are going to require protection: electronic PHI, ePHI, that's data stored or transmitted digitally; paper PHI, physical documents like charts, forms, printed lab results; and even oral PHI, as I said, verbal discussions about a patient's health or identifiers, hallway, waiting room, phone, all of that. So, when data does not need to be protected as PHI, not all health related or personal information qualifies as PHI under HIPAA. You should be checking with a professional. Please don't take my word for it. But here are some things that data does not require PHI level protection in the following cases as an example. De-identified data, health information that's been stripped of all identifiers, making it impossible to link to an individual, is not considered PHI. HIPAA's privacy rule specifies 18 identifiers that must be removed for data to be de-identified. That includes name, address, dates, except year, phone numbers, social security numbers, medical record numbers, and others. Any other unique identifying number, characteristic, or code must be removed. So me just saying headache, well, if there's nothing else besides headache, then there's no PHI. It's not linking to anyone. So aggregated data in a research study showing average blood pressure readings without names or IDs. So we average a 70% discharge rate in 30 days with babies that have torticollis. There's no PHI. That's just a general diagnostic statistic that I'm giving you as an example. And so requirement is that de-identification must follow either the safe harbor method, removing all 18 identifiers, or the expert determination method, statistically verified as non-identifiable by an expert. The other thing is data not held by a covered entity or a business associate. Information not created, received, or maintained by a covered entity or the business associate is not PHI. For example, personal health data that's stored in a consumer app, such as a fitness tracker that's not managed by a health care provider. Health information shared between individuals, patients discussing their condition to a friend, that's between them. That's not part of it. So if a private practice later receives this data, it becomes PHI. So the minute the patient submits fitness tracking data to your firm, your practice, it becomes PHI, just so we're on the same page. So when data does not need to be protected as PHI, so employment records. Now, I want to be clear, health information in employment records should not be shared. It should, so a doctor's note submitted for sick leave or whatnot, that should be maintained by the HR department, but should not be shared. That is technically, in my opinion, PHI under the HR department. Pre-employment physical results, etc. That is kept by the company, but they must protect that from other employees seeing that. If the employer is a covered entity related to health data, it can obviously, it will be PHI. So understanding also education records, health information and education records are covered by the Family Educational Rights and Privacy Act, FERPA. So school nurse records is going to be under the FERPA. Vaccination records held by the schools under FERPA. Health data in a student's IEP might be both FERPA and HIPAA, depending on who's storing it. The school under FERPA, but the provider under HIPAA, just so we're all clear. Some non-health related identifiers alone. Personal identifiers not linked to health information or health services. That might be a patient's name or address in a non-healthcare context, such as a marketing list without any health details, generic contact lists without health or billing information. Again, be careful. I'm not telling you like go out and do it, but just be aware. public information. So, health information that is publicly available and not tied to a specific individual's healthcare may not be PHI. General health statistics, information that is voluntarily shared in a public forum. Um, the other thing to think about is data after death with caveats. PHI protection generally apply to deceased individuals for 50 years after death. However, information that is de identified or not tied to a cover entity's records may not require that same protection. So a death certificate in public records may not qualify under PHI, but a deceased patient's medical chart held by a practice is most certainly PHI. So looking at all of this, the next thing I want to kind of go over is phone communication, protecting patient health information. HIPAA compliance for phone communication and text messaging requires private healthcare practices, covered entities, and their business associates to safeguard protected health information under the privacy rule, security rule, and breach notification rule. These rules mandate administrative, technical, and physical safeguards to ensure the confidentiality, integrity, and availability of PHI. You should not be having conversations open office or anywhere where PHI is being overheard. Below are some specific HIPAA compliance requirements for phone and text messages tailored to address the risks of these methods. So we want to look at minimizing the PHI disclosure. So we're looking at protecting the confidentiality. We need to verify recipient identity. We need to have secure environment, and we need our patient authorization. So everything must be written. We must make sure that we know when and what and how. So even when you call in, we are not able to discuss or that this is a secure line. You need to make sure all of that is really clear. We want to make sure we have our security rule with our technical safeguards in place. So a secure voice over IP system that is HIPAA compliant with the right encryption, access controls, and audit controls. And then obviously you need to have administrative safeguards. So we need to make sure we're training our staff. We need to have our policies and procedures. We need to have our risk assessments in place. And so when we're securing our phone lines, place phones used for PHI discussions in private rooms utilizing encryption for that phone service. Access control should be locked offices so that we're preventing eavesdropping. We need device security, ensure the mobile phones, cordless phones, or whatnot are encrypted and have security features like remote wipe capabilities if lost or stolen. Breach notification rule. We must know that if PHI is disclosed improperly via phone discussing PHI with an unauthorized party due to misdialing, assess, you have to assess it to see if it's a breach. And if so, notify effectively individuals, including HHS and potentially the media within 60 days, unless the risk of harm is low. So making sure you have BAAs with your voice service, your voice over IP, your mobile apps, your phones, all of that are really, really critical. So, HIPAA compliance requirements for text messaging. So, you must ensure that your text messages are encrypted, that encrypting all text messages containing PHI, both in transit and in rest, are using NIST compliant standards, TLS for transmission, AES 256 for storage, and that standard SMS and consumer apps like iMessage or WhatsApp do not meet these standards. So, you need to understand that. Just because a VoIP system says they are HIPAA compliant and do a BAA does not mean that they are encrypting and you can text through their system. There is a privacy rule protecting confidentiality, so you must send only the minimum necessary PHI in text. Appointment reminders without detailed health information. You must have patient consent. You must document consent and you must verify recipients to ensure that they are signing up for it and they are opting in. The other thing is you must have your administrative safeguards in place for HIPAA compliance for text messaging. This includes using texting platforms that are actually designed for healthcare. Tiger Connect, Spruce Health, etc. They offer these encryption tools. You want to train your staff, you want to have your policies and procedures, and you want to do your risk analysis. And so, putting in physical and technical safeguards for all devices, having device security, having security for the secure storage, following your breach notifications and storing your BAAs applicable is really important. So, here are the big things as a reminder. I want you to encrypt as a safe harbor. I want you to document and audit. I want you to make sure you're explaining and Educating your patients on their patient rights and vendor compliance is a big cornerstone of how you address your HIPAA protection methodology. And so, in public areas, we need to minimize PHI exposure at reception desks. We need to use discreet communication, avoid calling out full patient names, discussing health details at check in. Patient IDs and all that should be very, very private. Install privacy barriers and secure documents and screen protection. Control your waiting room interaction, limit verbal PHI, post signage, and manage patient flow. Something that's also important is you want to secure your physical records. You want to make sure that you're restricting access to any public areas, and you want to train staff on those public area protocols. And so these are all ways that we can get better at compliance and protecting patient health information. Did you know that according to a 2025 projection from the Medical Economics Physician Report, the average cost of a healthcare data breach for a small practice in 2025 is estimated to reach $250,000, including fines, legal fees, and patient notification costs? In the words of Benjamin Franklin, an ounce of prevention is worth a pound of cure. Thank you so much for tuning into this episode. Don't forget, together we can thrive, not just survive. Thank you for tuning in to the Private Practice Survival Guide podcast. I'm incredibly grateful to each and every one of you. Exciting news. We're now available everywhere, from Spotify to Apple Podcasts to YouTube or anywhere you like to listen to your podcasts. So watch, listen, and reach out. If you loved this episode, please drop a 5-star review. It truly means the world to me. Are you looking for more ways to elevate your practice? If so, now is your chance. Reach out, go to my website, or email me at brandon@wellnessworksmp.com. And remember, it's not just about surviving, it's about thriving.